Okay, so I have my patient, Mrs. Hartman, here, and Mrs. Hartman was playing soccer, and she was in the box when she felt someone slide tackled her, and she felt a crack in her shoulder area. Okay, Miss Hartman, can you tell me specifically where you felt the crack and then immediate pain after?
Right here, it was really bad.
Oh, okay. So, have you ever had any injury to this area before? Any injury or surgery?
Nope,
No injury or surgery. Currently taking any medications at all?
just Tylenol.
Just Tylenol help with the pain? Okay. So on a scale of 1 to 10, how bad would you say your pain is?
Like a 7.5.
7.5. Okay. Um. Okay. Is there any position that's comfortable for you to be in that relieves that pain in your shoulder, your left shoulder?
Just if I keep my arm down and straight, it hurts less.
Okay. So this is my functional outcome measure tool that I'm going to give to this patient, and she would fill out this measure tool to help me identify the severity of her injury. So that's what that is. And then I'm going to come over and palpate bilaterally. I'm going to palpate along the jugular, the manubrium, the jugular notch, and then the clavicle to see if I can find any deformities or obvious points of tenderness upon her clavicle. Actually, are there any, did you notice any edema or discoloration or obvious deformity of your clavicle?
It's kind of swollen right here at the side.
Okay. So I'm going to palpate bilaterally. So first I'm going to palpate the side that's uninjured just so I have an understanding of the structure of Miss Hartman's clavicle. So the manubrium, jugular notch is right here, AC joint, clavicle, SC and AC. Okay, and this is the injured side, and she's tender upon palpation. And there's an obvious deformity from what she's saying. This is an obvious deformity. So what we do from here, we wouldn't go into any special tests. So what I'm going to do is just split you and refer you to a physician to have x-rays done. And that's the end of Ms. Hartman's evaluation. Also, I'm going to check the distal pulse to Ms. Hartman's clavicle just to make sure that there's blood flow. Since it is a clavicle fracture, we want to make sure she's getting proper blood flow. I'm going to take radial pulse and take capillary refill around 2 to 3 minutes throughout the duration until she gets to see the physician. This is my patient, Ms. Hartman. Ms. Hartman is an aggressive forward for soccer, and she has injury of her left shoulder. So, Ms. Hartman, can you tell me how your injury occurred?
I was running for the goal, and I bumped into this other player, and I heard this crack, and now I can't lift my arm, and it really, really hurts.
Okay. Do you have any numbness or tingling in your arm?
Not really. It
Not
just
really,
hurts
a
when
little
I
bit.
move it.
Is there any noticeable swelling, discoloration of your arm?
Right here, up in this part, not my arm.
So there's swelling. There's no
Yes.
swelling.
There's swelling.
There shouldn't be swelling. This is my patient, Ms. Hartman. Ms. Hartman is an aggressive forward for soccer, and she hurt her left shoulder. So, Ms. Hartman, can you tell me what happened?
I was running for the goal, and I accidentally slammed into this other player, and now I have like this weird bump right here and some tingling in my arm, and it really hurts.
Okay, have you noticed any swelling or discoloration of your shoulder?
Not really.
Are you taking any medications right now?
Tylenol.
Tylenol for the pain. Have you had any previous injury to your shoulder? Any surgeries? Anything like that?
Not to my shoulder.
No, not to your shoulder. What else to ask? What makes the pain better or worse? Like, what is a comfortable position for your arm to be in?
If I keep my arm straight at my side, it doesn't hurt as much. If I try and move it, it hurts up here really badly.
Okay. Did you hear any loud cracks or pops?
I thought I heard like a crack
Okay. During the time of the injury?
at the impact.
At impact. Okay. So now we're going to go into palpation of Ms. Hartman's clavicle, and we're going to start, we're going to compare bilaterally. So first I'm going to go on the uninjured side because she has tenderness with palpation. So we're going to start at the manubrium, go to the jugular notch, and work our way over. And she said there is an obvious deformity, so I'm going to assume it's a clavicle fracture but still going to palpate gently over the
Ow.
injury site. And then I'm just going to split her in the position I found her and refer her to a physician. And the entire time I'm going to be taking a radial pulse and checking capillary refill to ensure that blood flow is reaching the lower extremity of the arm. Also, Since she did experience some numbness and tingling, I would check myotomes in her myotomes in her C4 and possibly C5 sections as well. Yeah, just refer to a physician for X-rays, and that's pretty much all we can do.